I mean, sometimes it's almost indistinguishable, right? So we have FemTech as an industry that's focused on the healthcare, and yet the whole thing is based on this DEI principle. So first, I'll reiterate what I said before. The backdrop to science has been male dominated. And so you can look at even the cells we use in basic scientific research, 75% of our cell lines are male only. And so when you're trying to screen for compounds to find cures for certain diseases, if you're only using male cells, maybe that compound you're testing would work if you had two X chromosomes. But because your cell line is an XY, it's a negative result. And so maybe it's getting thrown out into the trash. So we start with that basic understanding of science is male dominated. You move into animal models, 95% of animal models are male only. There's two studies that actually they gave endometriosis, which affects 1 in 10 women. It's essentially a very painful uterine disorder where the endometrial lining, the tissue that actually comes off every month during menstruation, is outside of the uterus. So it's essentially like internal bleeding. They gave this to male mice, cured it, found a drug that cured it. And as soon as they went to human trials, it failed immediately. And this is a really great case study of when the backdrop to science is male, and then you try to move it into female humans, oftentimes it doesn't compute. It's not the same. And there are really important factors we're not taking into account. Another factor here, and again, this is all the DEI because historically scientists have been male. And so they didn't think that there was that, and not to say that men were like, we don't care about women, but there are inherent biases that we cannot see ourselves until it is identified. And so what we actually see is the rise of FemTech corresponds to the rise of females in STEM. So the more women we have in science, technology, engineering, and medicine, the more female-specific solutions we're creating, which then in retrospect, you're able to say, oh, wow, look at that. When you have diversity in the laboratory, when you have diversity in the clinical trials, whether that be on the patient side, the cell side, the animal model side, or the scientist side, we now start to see things and ask other variables. In 2016 was the first time the NIH mandated that if you have an NIH research grant, you have to consider sex as a biological variable, which is bananas. What that means is that all NIH research between 2016 wasn't required to, if they did testing on males and females, they didn't have to separate that data and analyze it separately. And so what that means is that a lot of times drugs work really, really well for males and only subpar for females. And yet, when you summarize that data, it was statistically significant enough to get approved. And so you have, consequences of this lack of DEI in research, in regulation, in policy. For example, Ambien. Ambien is a pill that helps people sleep. Turns out the female metabolism metabolizes Ambien much slower than the males. And so for 20 years, there was these women getting prescribed Ambien and getting in car accidents the next morning. Finally, somebody said, this is uncanny. This is like, how does this keep happening? All these women who are taking Ambien are getting in car accidents. Well, it turns out they were still sleepy, so sleepy, in fact, that they were getting in car accidents. It is the first and only drug to date that the FDA recalled and then reapproved with sex-specific dosages. I hypothesize that there's many other drugs out there that females are being overdosed with because there are no sex-dependent dosages. So there's the DEI part in terms of our industry and innovation. And then in terms of our the founder side of it and like who's leading this movement, it is predominantly a female-led movement. Over 85% of our founders of these startups are female. I have yet to come across any other industry of which 85% of the founders are female. I don't know, maybe like cosmetics or makeup or like consumer packaged goods maybe, but like really that's only, certainly not in deep healthcare. And so it's really interesting to see this industry being driven predominantly by one sex, one gender. And you can actually see how that manifests and how our industry operates. There's a lot of collaboration. There's a lot of partnership. There's a lot of passion over profits. There's a lot of just passion in general. Most of our founders, I would actually categorize them as patient advocates. They're usually women who had endometriosis and had to wait 8 years for diagnosis, or had cervical cancer and, or felt a lump in their breast, but they were 28, and so their doctors dismissed them, right? And turns out it was cancer. And so these are very, very passionate women who want to help themselves, but more so want to help future women. And so the DEI aspect, just in terms of the demographics of who's leading the movement, is just, I mean, we don't have a DEI issue unless you think that we need more white men, then maybe. But it's like a really interesting kind of flip of the script there. I mean, we do have negative consequences because of that. We're underfunded and under-resourced, and I can dive into the consequences of this awesomeness movement. But those are some of the aspects in terms of the history and then the present day of our industry for DEI.